Good morning and welcome to, I think this is our sixth or seventh New Hampshire COVID Vaccine Alliance meeting. Just to quickly review for those who are new to this call, the mission of this alliance is to convene stakeholders in New Hampshire to promote vaccine confidence, support accurate and consistent vaccine messaging, and foster coordination with the vaccines allocation plan. Our goals are first to promote public buy-in for COVID vaccines to increase immunization rates in the state. Most importantly, it's really to act as a force multiplier to help support both the communications and allocation plans for the Bureau of Infectious Disease Control immunization programs. Third is to counter misinformation about the COVID vaccines. And fourth is to foster use of the New Hampshire Immunization Information System, which if you're not familiar with that, that is essentially New Hampshire's new vaccine registry. So takeaways from our previous meetings are that all 1A healthcare workers should be going into the COVID vaccine site that's listed there. We'll talk briefly, we'll talk a little bit more about what is happening today about second doses. Schedule your vaccine appointment at one of the 13 fixed sites. I can't tell you the number of practitioners who have tried to go into various other sites, particularly hospitals. When you're not an employee, you essentially, that appointment will be canceled and you're going to be put back in line for that first dose. So only hospital employees who've been told they should get their doses at the hospital sites. However, we do have new sites opening, and that's really to accommodate in some areas that are working with hospitals to accommodate phase 1B. Third, if you're not registered, we've had a number of cases where essentially because it comes from VAMS or CDC, people either one, don't recognize it, or it goes into your spam filter. So check that first. If not, we're recommending that you either email COVID vaccine scheduling at dhhs.nh.gov or call 211 for either first or second doses, particularly of 1A, as we'll go through today. Over the last couple of weeks, what we've seen with 1B be a couple of recommended steps here. COVID HON update, the 34B, and B is important, essentially put out for registering for medically vulnerable patients for vaccination. And again, these are patients and caregivers who are under 65. And there are two forms that are part of the HON, and our messaging out to physicians and PAs that have two forms. One is an Excel form that you can send in, then has the FTP site, the password and login, and there's a place for whoever is the practitioner essentially attesting to these individuals who meet the two medical condition criteria. And also as an individual form that's in PDF. We recommend that you upload this information for care coordination purposes, and two, that you email these patients to inform them that you've indicated the state that they do qualify under the phase B 1B criteria, and they should receive an email or text on how to schedule that appointment. Next slide, please. This past Thursday, you also likely saw email from us and from the Hospital Association to identify and resubmit those patients who are 16 to 17, essentially 16 up to age 18, who were medically vulnerable. They had some problems in pulling these individuals out, so they're asking through a memo that they sent out last Thursday to resubmit those on specially indicated forms that segregates those 16 and 17-year-olds out who are medically vulnerable. And also keep in mind, we're talking about caregivers to those under 65 who also qualify for that. So If you have a child who is under 16 and they're a medical caregiver, they are medically vulnerable, then you can qualify to also get the vaccine through this process, the early medically vulnerable process that we talked about. Again, follow the same steps as indicate these individuals that you have noted them as being medically vulnerable for the purposes of the COVID vaccine, and email them or their caregivers to indicate that they're going forward. And finally, next slide, please. Just want to thank our sponsors for helping us do this. They've been very generous in their support to allow us to do this activity, help coordinate in both the allocation and communication plan. I have also promoted two presenters, both Steve Anand and Vanessa Stafford, who are our partners here from the New Hampshire Hospital Association, as we're going through this. And if you want to jump into any of the questions, please don't hesitate to do that. But first, let me give you a quick couple updates here. I got a call about a half hour ago from T.W. Hall and Colleen Haggerty, who are essentially managing the New Hampshire allocation process for phase 1 and phase 1A and 1B. And they wanted to, they're essentially, they have a lot of issues going on in opening up second appointments. And so they had to politely beg out because they're a little bit overwhelmed right now in dealing with some of those issues. So first, at 8 a.m. this morning, they opened up the VAM system to second doses. And my information from them is that they opened up 6,000 new visits. However, the opening up of that process took longer than they anticipated. So when if you got on in the first few minutes, you probably either got some error messages. Now, the problem with this is you had to cancel your first visit, and so other additional visits weren't essentially opened up. And their advice to me is to have those, particularly 1A individuals, go back in the system and try to get that second dose, and I'll explain a little bit more. But there should be 6,000 new second doses available, but unfortunately, they're probably plowing through those numbers pretty quick. More specifically for the 1A, so they're opening up for essentially 1A this week and next week, 1,200 new, essentially second doses. So 2,400 in the next 2 weeks that are really targeting those 1A. And the way this works is you can't schedule before your allocation time of 21 or 28 days. So really, these are all 1A patients who will be available. What they're hoping to do is have these open up so that in the next couple of weeks, all 1A individuals can get their second doses in at this point in time. After, in about mid-February, their plan is to open up about 5,000 more second dose appointments. So it'll be a total of about 11,000 second dose appointments that they're opening up over the next month. And they realize the system for scheduling has been closed for 8 days. It may sound like or feel like it was much longer than that, but it was really 8 days that they haven't allowed anyone to schedule updates in VAMs at this time, unless you were working through the 211 or their systems to do some corrections at this time. So again, to repeat, the system had some challenges this morning kind of going in, but they're really focusing about 2,400 doses over the next, second doses over the next 2 weeks for the 1A participants to hopefully close most of that population out. The other information that was asked is all of the New Hampshire fixed sites will have, and those are the state-run sites with National Guard, they have doses of both Pfizer and Moderna. So if you got one, you for your second dose, you can go back to any of those public sites and they will give you your appropriate follow-up dose for the second dose as we're moving forward. So with that, Steve, I just wanted to ask if you had any updates or comments on how hospitals were doing right now with the allocation process.
Great. Thanks, Jim. Obviously lots going on, and we had a call with our members this morning. I think, the hospital pods that are up and, have been moving and functioning as well as they can. The limiting factor continues to be the number of doses of vaccine that they have available. Certainly the more doses that they have, the more vaccine that they can administer, and they're prepared and ready to do that. I did want to just respond. There was a question in the chat regarding some issues that occurred with appointments in Littleton. And unfortunately, what happened was when people went in to schedule those appointments, they were shown a list of available sites, and one of the sites was at the Littleton Hospital, but that was a closed site for their employees only. So when people scheduled those appointments had to be canceled because they simply didn't have vaccine available for the public for that clinic. It was an unfortunate issue. The VAMS system that we're all using does have some limitations and was unable to sort of blind that one, so that wasn't available for people to choose as an available site. So those appointments were canceled. There's been a lot of work, and in fact, you may have heard over the weekend, there were a couple of clinics, one on Saturday and one on Sunday, where they were able to sort of reach out to those individuals who had signed up and been canceled, and get them into an earlier appointment, which again happened on Saturday and Sunday. Certainly didn't get to everyone, but certainly I think the effort will be to try and get to as many of those folks as possible. Again, it's an unfortunate situation. The hospital certainly didn't want to be in a position where they had to cancel those appointments. Understand the frustration for those individuals who that happened to. Certainly no fault of the hospital. It's just a matter of rolling this massive effort out as quickly as it did. There were going to be some bumps, and as we've identified those, as the states identified those, we've all tried to work together to find a way to resolve those. But I think we're certainly making some progress. And again, it's all dependent upon the number of doses that we receive. The more doses that are available, the more doses that those hospital sites are going to be able to put in arms, and that's the goal.
Thanks, Steve. We also, if you saw the comments, it appears the same instance or the same happening occurred at Hampstead Hospital. So again, what we've been trying to tell everyone is, please go to one of the public sites and not the hospital sites, unless you've been specifically told to do something. What will result is you essentially getting a canceled appointment and trying to basically getting knocked back later.
Right, and there were a couple of hospitals where that did happen, and again, it's unfortunate, and I know folks are trying to resolve those to the best of their ability, and again, we're a couple weeks into the rollout. We're still going to have some issues and challenges, and again, try and get as many people vaccinated as we can.
Great. So. There's a question about what should we counsel our patients on who are having trouble getting the second doses emailed. Keep it in mind too, is if you've had one dose already, then go back into the VAM system. You don't have to wait for an email. So tell the patients to go back into go back into the system, use the same name and email address that they did to register for the first dose. And then as the Division of Public Health Services indicated to us, they opened up 6,000 new second dose doses appointments this morning. And those, as I understand, are kind of rolling out through the day as they fix some problems with the system. So I would encourage them to go back into the VAM system with that the first dose information that they submitted and see if some other appointments do appear. If you're a 1A qualifying individual, essentially anyone in a healthcare system and related, then they're trying to get those next second doses here in the next couple of weeks, because they know that in January, many of those that got earlier doses are kind of coming due right now. So if that doesn't work, and again, it's the same process, have those individuals who are 1A go back into the VAM system and try to schedule the second dose. If that doesn't work, then we recommend, as we did earlier, go in and use the COVID vaccines email address. And Brian, if you can republish that here in the question box so people can see that, or call 211. Again, I anticipate that probably 211 this morning is a little bit busier with the volume of individuals trying to get back in. If that doesn't work here in the next few days, and essentially they've opened it up for about 24 hours to try to get these, they anticipate getting these 9,000 second doses, or I'm sorry, 6,000 second doses appointments available, then they anticipate by mid-February having another 5,000 scheduled appointments for second doses. And these are all for essentially individuals in 1B. So your patients or constituents who would be part of that 11,000 kind of second dose schedules. I also say for the 1A participants, if you copy me when you're going back to the COVID vaccine email, then that allows me to follow up in specific and know if action's being taken on those cases. And sometimes we've been able to work with the division staff to work through some individual problems and kind of identify what was going on with that particular case. So we have been literally able to resolve hundreds of cases for 1A practitioners over the last couple of weeks, and we'll continue to do that. I probably fix, I would say, somewhere between 8 and a dozen of those type of situations per day. So that will go forward.
Hey, Jim, just one quick thing. Monica O'Clair from Huggins Hospital noted, and it's important. So people are able to schedule at hospitals that serve as open sites. There are several hospitals that serve as open sites. Huggins is an open site. I'm hopeful that we fixed the problem with those that are employee only, that those are not showing. But if they are showing, I believe they say they're employee only. So again, there are hospitals that are serving as open pods, and people can schedule at those. They just need to be certain that when they do, they're scheduling at those open pods and not at an employee only site. So again, just wanted to make sure that folks knew that there were hospitals serving in that capacity.
Thank you, Steve. Thank you, Monica. And most of the sites that are hospital only will say restricted. So if individuals are seeing that, that means that's not a site that you can really go, or not one of the public sites that they can do forward with. Next question, aware of folks, I'm sorry, just jumped on me here. Aware folks with 1B are scheduled appointments for this month at a public site only have canceled today and been told next available is April. Yeah, we've seen a number of those cases, or heard reports of those. And those specifically, I would probably have them call directly 211 and see if one of the caseworkers there can resolve what is going on with those cases. Again, if you see that from a patient, please copy us, and we can do our best to help follow up with those specific cases. But you're not alone. I've probably heard in the last couple hours a half dozen cases of individuals who had an appointment, then were canceled, and then pushed back to April. So that should not have happened, and unless there's something else going on there that we're not aware of. Let's see, another question, is the Lebanon site still open? We are hearing that that is not showing as an option. And if it is not showing as an option, it either is, it probably means that that site is all full with its dosage. Again, probably go back and check to see if additional appointments have opened up back in Lebanon. But I think that's what they're also trying to do is if a site is full, then they're essentially not allowing anybody to schedule into it at this time. Next question, is there a way to keep a list or a way for the state to reach out to our vulnerably elderly? They struggled to get already, and 211 wasn't able to schedule them. At this time, I know we're really getting into those populations that are a little bit more disenfranchised. And so this probably doesn't answer your question directly, but the other portion that I was informed about today is the 10% set aside, which is for those disadvantaged or disenfranchised populations in the state. And these are doses that are essentially given to the regional public health networks. And the public health networks are working in a variety of ways to identify these various populations. I know that DPHS and the Home Care Association had a meeting, and they're trying to work through a process of how they can most efficiently go to homebound individuals. And I should clarify, it's really homebound individuals who are receiving medical care. So when they're receiving medical care, then what they started to do the last week is go in. The issue here is many of these individuals can't schedule themselves. So the Visiting Nurses Association was literally going to the site, having to register those, having to answer all the questions with the individual there, and then give them the dose. And so some of these appointments were taking north of 45 minutes to do for a single administration because they have to not only give the administration, but also wait for 15 minutes. So we're working with the state to try to come up with a more efficient way of how we can identify these homebound home care individuals and improve that process so we can maybe get it down to like a 20-minute term. But I think the advice is if you know of individuals, then reach out to your local regional public health network and contact them and give them that information of individuals that you know that are struggling to get through and get a dose scheduled, particularly those who are vulnerable or elderly. So you can help that, but there isn't a statewide solution. So this right now, it really breaks down to each regional public health network and how they're handling each of these cases. We will have Kirsten Dersey, who is running that program, come into one of our upcoming new calls, these Tuesday calls, to kind of talk through that 10% allocation and how they're working with the public health networks to solve that. I hope that's helpful. So there's a point here about communications and tips and really reaching out to help troubleshoot for these individuals. So if you cannot hook up with your public health regional network, then encourage them again to try to get into the system. If they're having problems, encourage them to use 211 at this particular time to help move them forward. The other thing that we're going to be integrating into these calls is really more focusing on the communications. As we work through the next couple of weeks, what we're really doing is trying to get as many of the phase 1B patients in, and that is those over 65 and those who are medically vulnerable. and those who are in disenfranchised communities or homes or disadvantaged homes. And so that's what we're really trying to do for the next few weeks. And so having Christian come in and talk about some of those strategies is what we'll be working on. But we're also going to start working on some broader strategies for phase 2 and 3 when we get down into the broader public categories. And so we're working with some specific clergy groups, and we want to work with a number of you of how we can work with your members. And particularly, we'll likely do one session dedicated having the Business and Industry Association help coordinate that call, and talking to employers, how they can encourage their employees, getting them information that's accurate, it's factual, and where they can go get more information. But we think at this point, it's going to be important for these influencers throughout various communities, whether local leaders, employers, clergy, to be, as we move into these new public populations, to really kind of help be that multiplier effect to encourage individuals to sign up to be vaccinated at this time. So as we go in the next couple of weeks, we're going to be focusing a little bit more on the communications or intertwining those into our discussions. Okay, a question here or a statement here. Vans is indicating conflicting info when scheduling second dose for 1B individuals. It appears though appointments are open on the first page, then jumps a month into the future. We'll look into that. I don't have a accurate, that's some of the information that we saw earlier about people either getting canceled or getting bumped to the months. Again, it may be with the system right now that they opened up the 6,000 and that they're opening up today and then not opening up uniformly. I suspect that's some of the issues people are seeing today. So again, I'd probably go in, if you're having issues, go back in a couple times and see if you can't schedule for that second dose. But again, there's supposed to be about 6,000 new 1B second dose appointments opening up today. And that's why we don't have our public health partners here today, is because they're dealing with those issues right now. There's a question. We are uploading multiple Excel multi-patient spreadsheets to the, I guess what would be the DHHS FTP site, but are not sure if they're scheduled or not. Can the state at least confirm that they received the file? I can actually answer that. So you have to be, there's a small message that once you upload that file, it's on that screen. Once you've uploaded it, there's a small message there. We've asked that it be highlighted a little bit more. You won't get an email, but you can confirm that the file that you've sent it'll be a small message basically confirming. If it didn't go through, you would get an error message in part. So again, that's where you kind of have to look. It's not the best notification system, I know, but that's where the initial indication that your upload was successful. If it didn't go through successfully, we have heard that you do in fact get an error message. So if you're not getting the error message, you can't quite read the small type, it's probably that you got that information through. If you haven't, if your patients aren't getting those vulnerable patients, what I would tell them in the email, if they don't get a message within about a week's time, then please go back in and you can inform us that they're not getting that, or you can go back and try to re-upload that list. But typically the turn time is less than a week to get that scheduling email for the 1B medically vulnerable patients. Sometimes it's literally within, hours. It just depends on kind of what their volume and how they're processing those 1B medically vulnerable patient lists and how they're kind of coming in. Keep in mind they've gotten thousands of individual sheets, so they have to type those individually in, and it's better to use, from what we've heard, better to use the Excel spreadsheets because they can automatically upload that into the VAM system. So other questions that you have? Steve, is there anything, or Vanessa, anything we didn't touch base here with some of these questions that I've had?
No, I did put in the chat, somebody had asked if we could list the open pod hospital sites, so I did list those in the chat.
Thank you, Steve. There's a comment here from Dr. Wiskowski. Andy Slavitt, Senior Advisor for the Biden COVID response team, said that healthcare providers should not be holding back vaccine doses. Obviously, I have some concerns about this as a physician watching this unfold locally. Are you aware of NH's current supply and holdback, if any, at this time? And the answer is no. While there may be recommendations from various federal individuals, each state, particularly New Hampshire, does control its vaccine allocation process. So at this point, they're essentially not, because of the supply issues, they're ensuring that they have adequate second doses coming through. So once you get your first dose, but as you can see, I think it creates more problems down the line if we give all our supply away and can't schedule second doses in a timely manner. And I think that's what they're trying to correct, particularly in the next 2 weeks for the phase 1A population, is make sure that they have adequate supply. So when you come in for that second dose, you're sure that you're going to get it. So as far as we know, there's been no changes because of Mr. Slavitt's comments. Any other questions right now? Okay. Again, we thank you for participating. Next week, we will have our colleagues back from the Division of Public Health Services back. They've assured us, they apologize for this week. We'll be back. And we may be talking either about the 10% set aside and how those are being administered through the regional public health networks, or we'll start to go in and talk a little bit about communications planning and outreach in various groups. So Steve, anything else you'd like to add?
Oh, thank you very much. Appreciate the time and the efforts.
Again, thank you all for participating. We very much appreciate it. Keep in line, particularly physicians and hospital associations. Please know that we are communicating with all physicians, all PAs on a regular basis. So thank you for your time today. And if there's any other questions, we'll try to stay on for a few minutes and answer those questions in the chat box. So thank you for participating.